All right, guys, again, because we're running out of time, we're going to do some flip lessons, and then we'll talk more about this in class. We'll go pretty quickly here, so you can go back and look at it and pause it and do whatever you need to do. And then in class, if you have any questions, we'll, of course, go over those. But we're a little cut short for time because of the EOC, and we got this AP test coming up, so we need to get going. All right, so we're looking at social policy now as part of our public policy unit, and that includes healthcare, welfare, and education. I'm going to give you the poverty quiz in class, so that should spark some debate. All right, we're looking at two types of programs, majoritarian politics, and that's the program that benefits most citizens. So most all of us get Social Security. Most all of us have access to Medicare. So those are things that aren't means tested. We get those things just because we pay into the system. So there's no special qualifications that we need to meet or anything to get those policies. Then there's client politics, and that only benefits a few students. That is means a few citizens, rather, not students. It is means tested, and so you have to qualify for things like Medicaid and food stamps and other types of welfare. So means tested means that you have to fall below a certain income level. So again, you have to be tested. You have to show that you qualify for the benefit that you're going to get. So again, Social Security is one of those things that's majoritarian politics. The majority of us pay into Social Security. It was created in 1935, and basically what it does is it insures the unemployed and the elderly, and it gives workers a way to contribute and then benefit in the long run. Everybody is eligible for these insurance programs, and it also provides assistance for dependent children, the blind, and the elderly. So this was created during the New Deal, and it was created as a safety net to help those people who were struggling. Medicare was created in 1965, again, part of majoritarian politics, that once you become of age, you've paid into the system, so you will get the benefit of Medicare once you hit that age. It covers the medical care for the poor and pays doctors' bills for the elderly. Don't get it confused with Medicaid. Medicaid is for impoverished families, and that is means tested. Medicare is not means tested. Excuse me. So part of the problem with these welfare programs, especially Social Security, is that we are paying into Social Security and there's not going to be enough money left because of the baby boom generation. So we'll run out of Social Security or have to go into deficit spending to pay for Social Security. So there's a lot of people that are providing solutions to the problem, but the AARP is an interest group that does not want to change Social Security because those are the people who are partaking currently in Social Security. So here are some possible solutions. Some people say that we could raise the retirement age, freeze the retirement benefits, or raise the taxes. We could privatize Social Security so people could save on their own or have a way to save on their own, or combine the first two. Temporary assistance for needy families, it's called TAMP. It replaced aid to families with dependent children, so similar programs. These are means tested. It's a block grant program, so if you remember talking about block grants from the unit of federalism. And basically there are strict requirements and limits on what families can receive. By 2003, these cases were down, but it's probably gone up with the recession, the Great Recession of 2006, and so I would assume that these welfare cases have creeped up slightly over 60%. So all of these programs are means tested, and they are non-contributory programs, so you don't have to put into it to receive the benefit. So things like housing assistance, school lunches, the free and reduced lunch program, food stamps, Medicaid, Social Security benefits for the aged, blind, and disabled. And we can take a look at those on 511 in your Wilson book in your text. So you can see that TAMP has decreased, but again, I would assume that it's gone up slightly with the Great Recession. Social Security benefits have creeped up slightly, and then food stamps are continuing to go up. Arguments against welfare. Some people say the system costs too much. It gives too much reliance on the state. It's redistributive and could cause class welfare because people who have money are paying for the people who don't have money. And so some people argue that it needs reform. Arguments against it would be that it's good fiscal policy, it's a good stepping stone, it could give people a step in the right direction and get them back into the economy as a contributing member of society, and therefore start to eliminate the system of welfare. Reagan wanted to reform it. H.W. Bush followed Reagan and also wanted to reform it. Clinton promised to reform welfare, and he actually did, by creating the Personal Responsibility and Work Opportunity Act. So what it did is it limited the TAMP benefits and required work after 2 years of benefits, so people weren't able to take advantage of the system. It closed some of those loopholes in the system. Currently what's going on, this isn't going to be on your test, but Obama has set up new income thresholds, so it changes the standard of living, and we'll talk about that in class. I'll give you some examples. And the government will spend about $900 billion on some of these means-tested aid for the poor, so those welfare programs that we were just talking about, around $9,000 for each American in the low-income third of the population. Education is the greatest equalizer to stop poverty, so that has been an effort in the past with things like No Child Left Behind and voucher plans and charter schools, which we will talk about. But basically, you know, the age-old question is, how can we improve education and make sure that it is equal in all communities and everyone has the same equal access to good education? Statistically, who is poor? Minorities, women, and children are disproportionately poor. And when we go back to that quiz, I'll show you who fits in the categories and the criteria, what the statistics actually show. Single mothers are twice as likely to fall below the poverty line. We'll talk about why. And then, of course, we're still trying to achieve equal opportunity. So that's social policy in a nutshell. Again, I'm going to give you a lot of examples in class, and hopefully this helps with all of the things that we have going on in our time constraint. Thanks for listening, guys. Bye.